Right.
You guys hear me?
Hey, welcome everybody. Good evening. Thank you again for coming this evening, spending your time on Wednesday with us for a few moments. If this is your first time, welcome. I hope you have an opportunity to learn some new things about telemedicine and Health Alliance Network. And if you have been here before, welcome back. I know you know the information that we provide in these presentations are actionable and direct to the industry. So I know everybody's going to walk away with some new thoughts and new ways to execute their business. So we are Health Alliance Network, and we are a health and wellness company focused on care by way of live one-on-one interactions with doctors via a phone call or a video chat with a doctor, with a dermatologist, with behavioral health therapists. It is a one-on-one interaction. You have private time with doctor in the privacy of your home or wherever it is you choose to be. Health Alliance Network, if you're not familiar with us, Health Alliance Network started conceptually back in 2017. So we launched the company with the mission to provide better access to healthcare for everyone. And we started with the idea of working with rural parts of the country. So we started to develop effectively a doctor's bag worth of devices and equipment that could plug into, for example, maybe your cell phone or a like device. And from devices that can connect into your cell phone, there's a lot of diagnosis that you could do for folks remotely. And we're going to gather information and send it back to our doctors that we were working with for various care. So as we evaluated that, we loved the model, but it gave us just a small sliver of folks that we can really affect. And so we got to think bigger. So what we want to do is we want to start opening up doctors' offices around the nation. And these doctors' offices are called DPCs, direct primary cares, where you can pay a monthly fee for bringing you or your family to the doctor, and you'll have unlimited access to the doctor throughout the month. Brilliant. And we were able to bring costs way down, from what's average of $1,600 for a family for healthcare down to maybe $250, $300 per month for a family, which is brilliant. We work with state legislators around the nation. We're able to assist in getting laws and regulations passed to support direct primary cares, but it was slightly different in each state. And as we got further into the model, we were hindered, I'd say, also by the fact that although we were able to affect more people, it was still geographically not as a large amount of folks we can affect as we originally intended to, because we had the whole nation in mind. So then, after some more research and diving into the industry as a whole in healthcare, we landed on telemedicine, which was the perfect vehicle to bring healthcare to the masses. From here, we're able to actually reach every single body in the nation. Anybody who has access to a telephone, up to a cell phone, up to a tablet, can have healthcare for them and their family. So this was our mission, to provide as much health care as possible to everybody in the nation, and we are well on our way to providing and meeting those goals. So that is where we started. This is where we've come, and there's a lot more to the story as we're growing, which you'll hear more about through this broadcast and others. So thank you again for attending and listening to the opening. What I'm going to pass this over to Steve Utley. Steve Utley is our CFO, and Steve, please take it away.
Thank you, Steve. As we promised tonight, we were going to talk to you about healthcare uncensored. We all know that our healthcare system is slightly broken, and Health Alliance Network is doing what we can to help remedy some of that. We are bringing affordable healthcare to a reality through our telemedicine programs. We offer unlimited medical, unlimited dermatology, behavior health, and unlimited prescription benefits. What we're doing has changed lives all across America. We have been so busy these last few weeks, it's unbelievable. It's like the floodgates just opened. It's been crazy. We're working day and night to keep up with the demand for our product. It's like suddenly the light bulb went on in America and everybody wants to be a part of Health Alliance Network. We're really proud of what we've done. We're really proud of our team. We're really proud of the people that have joined us at Health Alliance Network. And I see we have a lot of visitors tonight. Hi, Jessica, James, Sarah. Welcome to the call tonight. I see Sarah's on the call. We have a lot of people on the call tonight. We really enjoy these broadcasts every Wednesday night. We will continue to do them every Wednesday night at 8 p.m. We'll have a different agenda each time we do it. But let's talk a little bit about healthcare Uncensored tonight. Healthcare Uncensored really talks about it. If you think about it, how broken our healthcare system is in America. We get together and we have friendly talks about all this all the time.
Day in and day out.
Day in and day out. And we're absolutely amazed at the stories we hear. For example, the other day we were talking, the other night we were talking to some new agents that just come on board, and they were talking about a special that they saw on PBS. It's something that we talked about on Health Alliance Network before. And the subject was, is your pharmacist being gagged? That was the subject line. And here's what it is. State and federal laws prohibit the pharmacist for telling you that you can get a better price on your prescription. That's amazing if you think about it. If I go in and my prescription cost with my insurance is $50, but I could buy it cash for $20, by law, they can't tell me that. The only way they can tell you that is if I ask them, is there a better price if I pay cash? Once you open the door, they're allowed to tell you, yes, the cash price is $20.
You know, and interesting onto that, we as Americans are not used to questioning doctors or questioning the pharmacist or questioning pricing. We're just trying to get a healthcare card so we can find some level of discount because we know all this stuff costs so much money.
Yes.
So the mad secret is exactly what Steve's saying, is it really doesn't.
It doesn't. The story got broke. It's an interesting story. A gentleman has a prescription that he gets every 90 days. That's how the news story broke. Every 90 days he pays for this prescription, and with his insurance it was $235. He and his wife are going to go out on an extended trip, go out of the country, but it had only been 60 days since he got his last prescription. Now the interesting thing about that, the insurance company won't cover your prescription until it's time to refill the prescription. So he'd only had it for 60 days. The insurance company denied it. And he says, well, let me just call the pharmacist and see what the cash price is. He's been paying about $235 for the last 3 years, was roughly his portion with insurance. So he called the pharmacist and said, I know my refill is not due yet, but is there a cash price for my prescription? And the pharmacist said, yes, the cash price is. He almost fell over it. He goes, I've been paying $235 with my insurance for years. And now you tell me cash price is $40, and that's how PBS broke the story. So the lesson here is always ask if there's a cash price, always. I had the same situation with me in an MRI. I went to get an MRI. My insurance cost with insurance was $610. So I hung up and I called him back and I said, is there a cash price? Yes, $300. I said, so let me get this right. If I pay with my insurance, it's $600. Cash price is $300. Yes. A lot of things go on in healthcare. Let's talk about a thing that insurance companies and pharmaceutical companies don't want to talk about. That's called clawback. I'm not going to spend much time on this today, but it's basically this. If the pharmacist could sell you the product for $5, but with your insurance, your deductible cost is $10, your portion would be $10, then the insurance company does what they call clawback. They pull it back from the pharmacy, that extra $5. Now, the insurance companies call it a rebate. We're getting a rebate from the pharmacy. So we're getting a rebate. So what that means is that really the pharmacy is paying off yes, the pharmacy is paying off the insurance company. We call it clawback. Really interesting. So keep that in mind. We're going to cover some of those things later on in our broadcast. We're going to talk about, hi, Sarah, welcome to the call. Hi, Vicki, welcome to the call. I see Vicki on the call. Leslie, welcome to the call. We have a lot of people on the call tonight. Those people in the audience probably can't see everybody that we see on the call, but we have a lot of people on the call tonight. Robbie, welcome to the call. I see you just logged in. We're going to get right to the meat of what we want to talk about tonight. And we're going to try to display to you what our intentions are. Tomorrow night, that's Thursday, right? Tomorrow night, Thursday night, we've been working on a project for nearly 4, 5, 6 months, day and night. We wanted to launch a new member experience. We wanted to launch a new agent experience. So we went to a clean slate. We completely erased everything we've done in terms of the website, on the forward-facing website, our public website, and the back end of our website for the agents. And we started with a clean slate. We said to ourselves, what would we do different if we started from the very beginning? And that's exactly what we did. So the three of us, myself, Steve, and Jim, who's going to come on in a few minutes, we started working on a completely new version of what we're doing. We're going to show that to you tonight, and we're going to work through it. I see Steve's on the call tonight. Welcome, Steve. I see you made it. We can't hear you, but you can wave anyway. We're going to show you, I'm going to turn this talk over to Jim just a little bit. And what we're going to do, the first thing we're going to do is show you the new forward-facing or the public website. And then Jim is going to go through the back side of the website with you and show you what you can expect to see on the back side of the website. So let me show you what the forward side of this website is going to look like here in just a minute. And here we come. It should be going live in any second here. Just see if we have it here. There we go. So that's our new website. I know you guys probably don't see what we see. There's probably a slight delay in this. Farah G is on the website tonight. Hi, Farah. Kenny, hello, Kenny. How you doing? Let's show the website. Here we go. Now we got it. Just had to learn which button to push. This is our forward-facing website. This is what the public will see when they go to our website now. You have a lot of motion, a lot of movement, a lot of interesting information coming through the website. One of the things that we talk about is that healthcare has evolved. When we first started talking about Health Alliance Network, our vision was a healthcare company and a health tech company. That has evolved into Health Alliance Network is we consider ourselves to be a health and wellness company. So we are a health and wellness company. Our primary focus, of course, at the moment is telemedicine. As you scroll down this page, we've made the page a lot longer. And when you first look at this, you're going to see that there's a video here. And the video, we took out all of the audio in this video. And for a reason, we had audio. We took it out because we thought the message was so strong with no audio. And the message is clear. It's skip the waiting room. Skip the waiting room. If you watch the video, it's about a 12-second video. It will welcome Kamal to the call tonight. Now that tells a story. The lady on the phone with the doctor, talking to a doctor via the laptop. This is the gentleman sitting in the emergency room, or I'm in the waiting room, my apologies, sitting in the waiting room. And then there's the waiting room, which everybody loves. Again, the website has a lot of information on the front page. On the very front, we also have, there's a bit of a delay when I scroll this. On the very front, we also have all of our health plans listed. We have unlimited telemedicine for the family and individuals. We have the employer and group plan for $14.99. And then we have the freedom plan, which is 3 months of telemedicine. Once you select one of those, you will go to the checkout page and you can select which program you want. Then we broke it down. If you recall on the old website, we had everything in one panel: unlimited doctor, unlimited dermatology, behavior health. So now what we've done is we broke that down into individual screens where you see unlimited doctor visits, and then you will see unlimited dermatology visits coming up next. And then right below that, you're going to see behavior health counseling. We now have a prescription benefit plan. It's forward facing, so you don't have to chase it down. You don't have to worry about where the prescription benefit plan, how do I find it? How do I get to the prescription benefit plan? You just scroll on the front page and everything you need will be right on the front page. As we continue to scroll, we talk about our incredibly simple healthcare. I've got to learn to catch this up just a little bit quicker, don't I? The screen looks like it's running a little bit behind what I'm saying. There's a slight delay in the video versus the audio. That's this screen says incredibly simple healthcare. Again, you have an opportunity to shop our health plans or click on prescription benefits and go right to the prescription benefit plan. Next, we have a very simple 60-second video that shows everyone how it works. What is telemedicine? What is telemedicine today, and where is it going? This 67-second video is very, very informative, and I encourage you to watch it when you get to this home screen. What we have right now in terms of the website that's up, this is a temporary site. This is a holding site for us. As we spoke earlier, we would tend to go live tomorrow night, or go dark, I'm sorry. We're going to go dark tomorrow night at about 6 p.m. Eastern time. At 6 p.m. we'll go dark. We're going to be switching over to the new servers and the new site. And from there, you should have everything you need to move forward, hopefully within a few hours. What do you think?
Days.
We'll see what happens.
One of the ideas of our new design was we received a lot of feedback from the field. We received feedback from the agents. We received feedback from our customer base. And what we found is on the original site, we have all the information available. However, the ease of navigation, we wanted to bring it into just one screen. And the ability to take your phone and scroll on one page to have a lot of information available to you in one shot, so you're not hunting around on your phone, on your devices, seem to be very well received in our focus groups. So you're going to notice that in this design, we really took those elements to heart and started to kind of design more of everything that's needed, especially on a presentation, all on the first page, so nobody has to hunt for what it is that they want to understand about the program.
Steve, I'm going to cut away to Jim. Jim, we're going to go to, I understand we're having some audio problems tonight. I'm going to cut away to Jim. And Jim, we're going to go to the agent site. I'm going to click on agent site, and we'll be able to show you that. And this will be the new back office. Jim, can you hear us?
Yes, I can hear you. You're able to hear me? Okay. So I believe what we're looking at is the home page of the back office. Is that correct? All right, Steve, if you're able to click, because it's your screen that's being shared, if you could click to my profile. And at the top, you'll see some of the it's 4 different sections. If you can click on personal details. Great. And what you're going to see there is going to be your personal information and additional information. On this screen, what you'll be able to do is to update that information just for your profile. So you'll be able to see where the name is and everything like that. There's a couple of things that I want to point out. At the very top, you may or may not be able to see it. What that is your affiliate link or your agent link. That's going to be the very specific link with, at the end of that link is what is it's called your referral ID. If you look down towards on the left-hand column, you'll see your username, which is your email address, your password. Retype your password, first name, last name, and then your referral ID. That's what's going to be your unique ID that only is for the agents/affiliate. That's the code that's going to be put into all of the banners and links and emails that are going to be shared out. So if you send out some banners and links, which we'll show you here shortly, if you share out banners and links, and then you go back into your profile and you change your referral ID, and then you click save on the bottom, all of the banners and links that you sent out will be inactive. They won't work anymore because they won't refer back to your referral ID. So it would be important to keep the same referral ID that you always have, or resubmit banners or links to go out. You'll upload a photo and just go through, put in your phone, your address, your fax if you have one, and you can go through that. Okay. One of the things I'd like to go over, because we don't have that much time, is Steve, if you can click on the promotions section, and you can look at, we have campaigns and banner links. Let's go to banner links. We're going to skip campaigns for now. These are, Steve, if you could just scroll down and slowly and just kind of give an overview. These are all the banners. These are templates that are available for all agents and affiliates. And you'll see below the picture that there's the F for Facebook, a P for Pinterest, the Twitter sign, Google+, LinkedIn. These are already in existence, and every time an agent or an affiliate clicks that to share it out on social media, it's going to link back specifically to you. Okay? Steve, I'm not sure if you want to demonstrate kind of how that will look or not. You can maybe do like, scroll down to like family 10. They all have different names. They all have unique codes. There you go. You got one with the family. And down below it, just click, all you got to do is click on the, say, the Facebook. There you go. That'll pop up. I don't know if we'll be able to see the pop-up because of the screen. And then it would post to your Facebook, whichever Facebook account you're logged into on that browser. It'll automatically post there. Okay. We also have template emails. There you go. We also have template emails that are already pre-written. And all you have to do is to share it with a friend. You can just select it. And you're going to just click on send to a friend. Put in the email address that you want to share it to. You have to click apply. There you go. And then send to a friend. Click on an email address that you want to send it to. And then scroll all the way down. See, there's the, up at the very top is the email address where you type in the email address. And this specific one that Steve's demonstrating is directed at employees. So you would type in an email address, scroll all the way down, and hit send. Now, one of the things, there we go. One of the things that we skipped over under the promotion section is the campaigns tab. These are different campaigns. So if we want to target families, we have different banners and links specifically for families. If we want to target employer groups, we have specific banners, links, and emails that target employers. If you want to look at fundraisers, we have specific banners and ads and emails that are targeted at fundraisers. All of these are already pre-templated, which they're already in a template format. You're able to, the emails, you're able to send them out. The links and the banners, you're able to share them out. We have a variety of banners and images and looks. We're going to be adding more. And once we add one, they're going to be available to everybody. And everyone is going to have your unique, the system sets it up so it's coded as we do it as the administrator. It's coded specifically for you. So here's the really cool stuff about that. If you submit a link or a banner and somebody clicks on it and they buy today, you're able to track it. If you submit a banner and somebody clicks on it today, but they don't buy until maybe next year or 2 years from now, that still is credited to you. The banner, when they click on the link, is able to save a lifetime cookie on that computer in that browser, so that person is always connected to you. So what's the name of the game? If you're an affiliate or an agent, get as many people to click on your banners and your ads as soon as possible, because they will be forever connected to you, whether they buy today, tomorrow, or next year. One of the ways, another thing that we have under promotion is called ad channels. This is pretty cool because let's say you have banners that you're sharing on Facebook versus banners you're sharing on LinkedIn. Or you have your own website and you want to see, you have a banner on the side and a banner on the bottom. And you want to see how one banner performs against the other. It's your ad channels that are going to demonstrate that. So if you want to see if sales and clicks are coming from your Facebook versus your LinkedIn, that will give you all of that information. If you want to see if you have a website and there's a banner on the left side of your website and on the bottom of your website, and you want to see how they compare, it's the ad channels that are going to give all of that information. You'll be able to see how many clicks you have versus how many sales you have on your banners and who they are, where they come from, all of that information. And again, this is lifetime links. So as soon as somebody clicks on your link on the new system, they're going to be going dark on in 24 hours, 22 hours. It is all of this that you're going to be able to view and see. We are putting together training on all of this. You're going to have training videos available to go over all of this. Don't think that this is the only training that's going to be available. But this is what we have. This is what we're working on. As agents and affiliates, you're going to have access to reports. As agents and affiliates, you're going to have access to more detailed information as well for when you're doing face-to-face meetings and face-to-face visits. So Steve, is there anything else that we want to go over on the back office at this moment? I can't hear you in case you're talking. Okay, this is Jim back. Let's see. I am not able to see what we're looking at here. I think we're looking at the agent hubs. So we can go over here to the agent hub. And there's a lot of information here that's available for everybody. Getting paid, that's pretty important information. I'm sure every agent and affiliate is going to want to know how to get paid. There's marketing ideas. And here's a bunch of more information, some more links that you can have access to. And Steve, if you can click back over to the main agent hub, just so we can look at there's different logos, there's training, there's employers that have marketing studies, templates, and other materials for employers and groups. There's marketing articles and email templates with consumers. There's a video library, testimonials, credit card ACH, fundraising, emails, and then we're also using PayClicker. So there's a lot of information that's going to be here in your back office, in addition to all of the other reports and promotions and everything that we have access to currently. But a lot of good things. Again, we're going to be looking to do this weekend. Actually, tomorrow in 22 hours, we're going to be going dark trying to do this pushover. And that's about it for the back office. I'd like to thank everybody for coming in, checking this out. Let's see, I want to say, Ron, thank you. Leslie, it's a pleasure speaking with you earlier. We're going to send out a notice tomorrow on the plan. So check your emails for that. And everybody, thank you so much and have a good evening.